Good morning everyone. Welcome back to channel Medical with Sanju. Today question on medication used into obstetrics. Question number 785. Injection metharzine is given at the time of delivery. Option A, in the first stage of labor. Option B, to induce labor. Option C, to prevent PPH. And option D, after placental delivery. Injection metharzine is given after delivery to prevent PPH caused by atonic uterus. Option C is right answer, to prevent PPH. Question number 786. Argometrin is useful in the management of option A, eclampsia, option B, PPH, option C, eclampsia, and option D, twins transfusion. Argometrin is also used in the management of PPH. Option B is right answer. Question number 787. One of the purpose of giving injection metharzine following the delivery of placenta and membranes is diet it. Option A, relief after birth pain and discomfort. Option B, relax uterus so that mother has less pain. Option C, stimulate uterine contraction. Option D, suppress lactation. Stimulate uterine contraction. Option C is right answer. Question number 788. Which of these drugs is contraindicated in a laboring mother with the hypertension? Option A, oxytocin. Option B, prostaglandins. Option C, metharzine. And option D, magnesium sulfate. Metharzine. Because metharzine PPS manage गर्नको लागि after delivery दिन्छ. Option C. Question number 789. In which patients methyl argometrin is contraindicated? Option A, heart disease. Option B, lungs disease. Option C, liver disease. And option D, kidney disease. Heart disease. Option A is right answer. Question number 790. The importance of prostaglandins in onset of labor is to option A, stimulate expulsion of fetus. Option B, stimulate uterine muscle activity. Option C, reduce uterine muscle activity. And option D, help in the placental expulsion. Stimulate uterine muscle activity. Option B is right answer. Question number 791. Prostaglandin analogs are used in the option A, induction of labor. Option B, induction of abortion. Option C, all of these. And option D, management of PPH. Prostaglandin used in induction of labor, inductions of abortion, management of PPH. All of these are right answer. Option C. Question number 792. Which prostaglandin helps in cervical wrapping? Option A, PGE1. Option B, PGE2. Option C, PGF2. And option D, PGI2. Two analogs of prostaglandin, that is PGE2 and PGF2 alpha, used to produce oxytocin effect on the pregnant uterus. PGE2. Option B is right answer. एउटा PGE2 हुन्छ र अर्को PGF2 alpha हुन्छ. Question number 793. One of the greatest dangers in giving morphine sulfate during labor is option A, depression of respiratory center of newborn. Option B, it increases blood pressure of the woman. Option C, produce nausea and vomiting. And option D, prolongs bleeding time of mother and the baby. Depression of respiratory center of newborn. Option A is right answer. Question number 794. While administering oxytocin infusion in a term pregnant woman, what rate should not be exceeded because it is likely to cause a tetanic contraction? Option A, 2 milliunit per minute. Option B, 4 milliunit per minute. Option C, 16 milliunits per minute. And option D, 20 milliunits per minute. 16 milliunits per minute. Option C is right answer. Question number 795. The purpose for using oxytocin, pitocin during labor and delivery is to: Option A, provide pain relief. Option B, stimulate effective uterine contraction. Option C, prevent premature separation of the placenta. Option D, increase ability for nutrients and oxygen to cross the placental blood barrier. Oxytocin uterine contraction बढाउनका लागि दिन्छ. Stimulate effective uterine contraction. Option B is right answer. Question number 796. A client at 38-week gestation is admitted for induction of labor. Her membranes ruptured 12 hours ago. There are no other signs of labor. Which medication dose the nurse anticipate will be prescribed? Option A, magnesium sulfate. Option B, estrogen. Option C, oxytocin. And option D, dinoprostone. Induction of labor को लागि oxytocin दिन्छ. Option C is right answer. Question number 797. A patient in the second stage of labor is given which of the following injection to improve uterine contraction? Option A, oxytocin. Option B, metharzine. Option C, fenregan. And option D, diazepam. To improve the uterine contraction, should be give oxytocin. Option A is right answer. Question number 798. The drug or hormone used for induction of labor uterine contraction is: Option A, metharzine. Option B, ergometrin. Option C, oxytocin. Option D, progesterone. You know very well, uterine contraction को लागि induction of labor मा oxytocin दिन्छ. Option C is right answer. Question number 799. One of the hazards during induction of pitocin is: Option A, elevation in blood pressure. Option B, infection. Option C, rupture of uterus. And option D, early rupture of membrane. Rupture of uterus. Option C is right answer. Question number 800. Major side effect of oxytocin is: Option A, diuresis. Option B, hypertension. Option C, uterine hyperstimulation. And option D, uterine atony. Uterine hyperstimulation. Option C is right answer. Question number 801. When uterus is overstimulated by oxytocin, which of the following sign nurse can identify? Option A, weak uterine contraction prolonged to more than 90 seconds. Option B, increased labor pain with a bright red vaginal bleeding. Option C, tetanic contractions prolonged for more than 90 seconds. And option D, increased restlessness with pain. Tetanic contraction prolonged for more than 90 seconds. Option C is right answer. Question number 802. Nurse should monitor intake and output during oxytocin administration because drug. Option A cause water intoxication. Option B cause toxicity for kidney. Option C increase thirst. And option D induce diuretic effect. Because oxytocin cause water intoxication. Option A is right answer. Question number 803. For what complication should a nurse monitor a patient when a oxytocin infusion is used to induce labor? Option A, intense pain. Option B, uterine tetany. Option C, hypoglycemia. And option D, umbilical cord prolapse. Uterine tetany. Option B is right answer. Question number 804. During assessment, nurse observed sign of a fetal distress. See immediately. Option A, if on oxytocin, stop it, start IV and oxygen. Option B, inform doctor, start IV and oxytocin. Option C, stop oxytocin and inform doctor. Option D, shift the patient to OT with IV. यदि चाहिँ oxytocin चलिराखेको छ पेशेन्टलाई र फिटल डिस्ट्रेसमा गयो अथवा मदर पनि डिस्ट्रेसमा गयो भने इमिडिएटली अक्सिटोसिन स्टप गर्नुपर्छ र आईभी स्टार्ट गर्नुपर्छ र अक्सिजन पनि स्टार्ट गर्नुपर्छ. Option A is right answer. Question number 805. Drug not given in pregnancy is option A, ACE inhibitor, option B, penicillin, option C, methyl dopa, and option D, labetalol. ACE inhibitor is a group of antihypertensive drug that is enalapril, not used during second and third trimester of pregnancy because it increases risk of fetal renal damage. And it is a teratogenic in first trimester. Option A. Question number 806. Which of the following antihypertensive drug is contraindicated in pregnancy? Option A, hydralazine. Option B, alpha-methyl-dopa. Option C, metoprolol. And option D, enalapril. Enalapril is a group of ACE inhibitor antihypertensive drug. You चाहिँ avoid गर्नुपर्छ. Option D is right answer. Question number 807. Prophylactic agents are used to option A, enhance the preterm labor, option B, suppress the preterm labor, option C, enhance the normal labor, and option D, suppress the normal labor. It is to stop premature labor. Option B, suppress the preterm labor. Option B is right answer. Question number 808. Complication of a prophylactic agent is option A, uterine rupture, option B, hyperstimulation of uterus, option C, increase peristaltic movement, option D, pulmonary edema. Pulmonary edema is right answer, option D. Next question on Piparium. In other video, thank you so much. Please like, share, comment and subscribe the channel. Thank you so much.